Welcome, Chris and Nicola, to this very special episode. Special because it's about me. How long has it been? About a year? I did promise Nicola I could get it up.
I think you were very honest with the fact that you weren't particularly keen on exercise. Has that changed at all?
No.
Okay.
Look at me, I'm a Teletubby. I'm exercising even less. Catherine Ryan, my result is now. Hello. The time has come to find out what age I really am. This is What's My Age Again, the podcast that finds out how old your body is and how you're aging on the inside. Today, I'm in the hot seat. As you may know, last time I did the test, I was 77, the oldest person on the whole podcast. Since then, I've been doing some of what Dr. Nicola Conlon has told me. Not much, but some. And I got pregnant again. How will carrying another human have impacted on my biological age? Chris Whincup is back. He is a consultant rheumatologist specializing in lupus at King's College Hospital in London. And Nicola is here, of course, too, to tell me to do more exercise. Advice I will ignore. And for those of you who don't know, Nicola is now hosting a bonus episode called Dr. Nicola's Second Opinion. So check that out, too. Welcome, Chris and Nicola, to this very special episode. Special because it's about me, my favorite subject. A lot has changed in my life since my first biological age test. Namely, my mother has been calling me crying about my first biological age test. So we're going to find out what it is today. Lower, higher. I did promise Nicola I could get it up.
He did.
See.
Yeah.
How long has it been? About a year since my last test?
Yeah.
10 months, 11
Yeah,
months?
just under a year. Yeah.
Okay. Catherine Ryan, my result is now 57 years old. It is still 15 years older than my chronological age, but 20 years younger than my last
Wow.
test.
Yeah.
Chris Whincup,
Hello.
rheumatologist,
Yes,
consultant,
indeed.
specialist, genius, science man.
No pressure.
What happened?
This is a good result. I don't really know what happened, but I may be able to guess a few things that might have improved. I know that last time you said, I think you were very honest with the fact that you weren't particularly keen on exercise. So has that changed at all?
No.
Okay.
Look at me, I'm a Teletubby.
I-
I'm exercising even less.
I mean, that could also be the thing that might have changed. So first of all, congratulations.
Oh, thank you. Yeah.
It'd be interesting to know whether perhaps the pregnancy may have done something to the tests.
Yeah, because Nicola, I know that glycanage chiefly tests inflammation.
Yeah.
I do have lupus. I have celiac disease as well. Who knows? Because autoimmune diseases do stack. I could have secret ones I don't even know about yet. Though I am usually asymptomatic for lupus, my symptom is really just miscarriage. So that tells me that my inflammation and my autoimmune response in early pregnancy and conception anyway is quite toxic, yeah?
Mm.
But then is it known to sort of modulate itself in later trimesters?
Yeah. And what we see generally is that the immune system kind of goes through a little bit of like a reset
Yeah.
during pregnancy, especially once pregnancy is established and the hormones start to change.
Mhm.
So you've got different types of estrogen, and there's one estradiol 3, which actually turns down the immune system. And I think in very simple terms, it's almost like the body protecting the baby. And it doesn't want to do anything that's going to trigger any sort of inflammatory reaction. So it almost, for most times at the expense of the mother, turns down the immune system.
And that's why pregnant women are sick a lot. Like they have a stuffy nose. Is that it?
I think there is a part of that, but I think
Yeah.
it's really interesting because I think we mentioned last time about lupus being this condition where your immune system's overactive. And actually what your immune system is there to do is to protect you from things that shouldn't be there. So bugs. But in lupus, it gets overactive and goes after yourself.
Yeah.
But if you think about what happens when you become pregnant, you start to grow something that is a bit like you, but not completely like you. So the immune system has to kind of switch itself off a little bit for the sake of the baby. And there is some suggestions that maybe as that happens, the immune system starts to quiet down. And if you've got an autoimmune condition, maybe it starts to quiet down a bit as well.
I mean, it is still high though, because if you told a normal 42-year-old your biological age is 57, they might have an unpleasant reaction on this podcast. But because we know that mine was 77, 20 years younger seems like a good result, but it's still bad.
Yeah, I think had we been sat here and not had last year's result, we would have been surprised that it was higher. But I think it is really interesting to see that suddenly drop and thinking about it, trying to work out what it was that potentially has shown that better result. Now, I think the reason it's probably not close to your actual age could still be due to autoimmune conditions like lupus. But from that result, you would suggest that perhaps things have improved. And the big thing that's happened in the last 10 months since you had that test was probably the pregnancy. So I wonder if that's
Yeah.
the thing that's having the influence on it.
Well, wasn't it advised for women with lupus in the past just not to start any pregnancy at all? And they would have unpredictability. I mean, is that just if their lupus is not managed well or they might have a flare? Like, what do you say in clinic to women who are planning a pregnancy with lupus or any other autoimmune disease?
Sure. So I think thinking about lupus in particular, and I think one of the things I mentioned when I was last here was that doctors are quite defensive. And so there is a risk that things will get a bit more challenging in the setting of pregnancy. So historically, many people used to say, oh, it's a bad idea to think about getting pregnant. We won't take that risk. And unfortunately, that means that historically there are a generation of women with lupus who were discouraged from becoming pregnant. And thankfully, that's not where we are today. As I mentioned before, lupus is very, very discriminatory. We know 9 out of 10 patients are female, and many of our patients are young. So when I'm seeing people with lupus, pregnancy is something that we talk about a lot.
And a lot of them are Hispanic or Black or non-white?
Yeah. So we know that the disease tends to more unfairly affect people who are of African ancestry. But I think what we find is we should not be frightened about talking about pregnancy in lupus as doctors.
Yeah.
And I actively encourage it in a lot of the discussions we have. There are things that you'll find that make it sound risky, but we can manage that risk. And I think that it's something we really need to discuss frequently with people.
What are the risks for pregnancy in autoimmune diseased
Sure.
women?
So I'm going to caveat this with most women with lupus have successful pregnancies without complication. So I
Right.
don't want people to take away from this that there are things to worry about. There are some fairly unique things to lupus that we need to think about. And number one is whether the lupus flares up. So we don't want the mum to be pregnant and having a big flare of their lupus. And the best way to mitigate against that is to make sure that the pregnancy is well planned, ideally about 6 months after their lupus has come under control. So they're going into pregnancy well controlled. And importantly, they're on medicines that are safe, because there are some medicines that we give to people with lupus that are not safe for pregnancy and are of high risk to the baby.
Like
So-
what? Like the sort of chemo ones?
Yeah, and there's drugs called mycophenolate and methotrexate that we know are not safe for
They
pregnancy.
sound great.
Yeah, I mean, all of our drugs sound pretty frightening, but those are the ones that we really worry about in pregnancy.
One's got the word meth in it.
Yes, yeah.
Is it like meth?
I don't think anyone's described it quite in that way. I've not seen those kind of effects.
And the other one sounds quite like petrol-y.
Yeah, mycophenolate. Yeah,
Oh.
yeah, I know. We
I
don't.
haven't
we don't
been
put friendly
offered those
names on
ones,
those.
Chris.
That might be a good thing, because actually
Mhm.
we tend to reserve those for people who have perhaps more moderately active lupus.
All right.
Everyone with lupus, whether they're planning to get pregnant or not, should be on a medicine called hydroxychloroquine, which I think we talked about last time. We don't really know why it works, but we know that it is safe during pregnancy. And we know there are certain things in lupus pregnancies that it helps protect. So we know there are certain antibodies in the mum's blood that can get to the baby. And by being on hydroxychloroquine, you reduce the risk of that happening. So if you're looking at pregnancy as a whole, plan, talk to your rheumatologist, talk to your doctor, and make sure that everything is safe. Sometimes surprises happen, and we deal with that, but we'd much rather have everything nicely controlled, all set up and all planned out to make sure the outcome's best.
Well, that's ideal really for any family
Mm.
looking to have a baby. But I don't know how realistic it is. Loads of people should plan. Loads of people are not financially solvent.
Yeah.
They're in a bad relationship. Their health might be okay, but everything else is an absolute garbage fire. So, I mean, especially if you're older and you have lupus and you want to have a baby,
Mm.
I think it would be really frustrating to hear from my rheumatologist, which I don't have. Oh, let's wait till we get your lupus
Yeah.
under control, because that feels so intangible. You might be like, well, that will never happen for some people.
I completely agree. And I think that we are in these positions where sometimes people say, look, I want to do this and I want to do this as soon as possible.
Mhm.
In which case we want to balance the risk. We have guidelines saying, okay, we want it well controlled for about 6 months. But understandably, some people want to go a bit quicker. And that's for a discussion between the person with lupus and their doctor.
Yeah.
And we try to personalize it to each individual. So it's easy to say, look, your best outcome is if we do this. But if there is an increased risk, then we just need to make sure that we're in good communication and monitoring closely and doing everything else we can. So making sure that person's on good medicines and getting seen really regularly and monitored regularly.
Yeah. Well, I'm so weird for lupus because I don't have symptoms. My symptom is miscarriage. And when I took my first biological test,
Mm.
it wasn't really a measure of my normal
Mm.
resting inflammation rate anyway, because I had been pregnant then as well. I lost a pregnancy after about 3 months. Then I had surgery to, what did we call it? Retrieve the products of conception from that pregnancy. And then I was really stressed and I was on tour. And for me, I think my inflammation, and it's interesting when you say that 9 out of 10 people with lupus are women, and they're also women who have an added layer of potential stress, like being non-white in the current world that we live in. Stress seems to like inflame me quite a lot. And I was stressed when I took that 77 biological age test, like stressed to the max, actually, which I no longer feel. But Nicola, I wasn't eating 30 plants a day.
Wasn't exercising.
But I am active. Like,
I think it's really relevant as well what you were saying about there was all of these different factors going on. And, we know that anything to do with pregnancy and miscarriage will massively alter your hormones. And we know hormones play a big role in inflammation in a woman's body. So, at the moment we're seeing, and I do think this result is to do with the pregnancy. I know we're kind of theorizing that may, if that's even a word, that may be what it is. But the reason I do think that as well is because when we measure the biological age with glycan-age, we look at several different markers. Some of them are pro-inflammatory, so make inflammation worse if they're higher, and some of them are anti-inflammatory and a bit more protective. And what we did see on your results is that one of them that is protective, and it's the anti-inflammatory one, went up. So it does seem like in your body is flipped on this switch that's going, okay, let's just dampen down this inflammation. So
with that,
whether usually that's not, you don't normally see that one change due to things like stress. There's some other ones that we look at for that. That's usually one that's much more influenced. Sometimes we see it in people where they're kind of genetically blessed and they always have really high levels of that.
The Joanne McNally's of this
Yes,
world.
exactly. So this is one that kind of like, it takes a lot to change it. It's not one that's kind of lifestyle related. There's other ones that we look at that are lifestyle related. So I do definitely think there is some influence of the hormone side there.
Yeah.
And we know this type of estrogen that does get released during pregnancy is known to be anti-inflammatory. So
does that mean it's maybe a girl if I have more estrogen?
I don't think it affects that. It's your estrogen. Your estrogen.
Damn it. Also progesterone, I think, in late trimesters goes up. And does progesterone modulate inflammation?
They all play a role. They all do play a role.
When we took the last test, I don't know what would have happened. I would have been really low estrogen.
Yeah.
Really high cortisol, I think.
Yes, yeah.
And then I don't know what progesterone does in a miscarriage scenario. I'll investigate. So does that mean when I'm no longer pregnant, and when I'm no longer pregnant, Dr. Wincup, I never want to be pregnant again. But this seems to be the fountain of youth for me. So like, can I emulate like a chemical pregnancy? Should I just take loads of progesterone? Or will I get breast cancer if I do that? Or is that the one that gives people breast cancer if they take too much?
So it's a really good question. I think a lot.
I don't think it was a good question.
I think it's a great question because I think
it's
you
very
can see,
scientific, actually.
What we're talking about is that people tend to say things get better during pregnancy, and we can see perhaps from this immune age test that it's had a shift on inflammation. But how do you kind of make the body think it's pregnant when it's not pregnant gets really tricky because we know that actually in certain circumstances, certain types of estrogen can make lupus worse. So,
Yeah.
for example, if you take the contraceptive pill containing estrogen, then that's high risk in lupus.
Hang on.
Yeah.
Let's clip you
Yeah.
back to the first episode where we were so blessed to become acquainted with you when you said that I should embrace menopause. I think those were exact words.
I mean, I might have been slightly misquoted there, but I
Okay.
think what we tend to see is that actually when people get towards the menopause, that the lupus symptoms tend to reduce, and that people tend to be in a slightly safer position after the menopause than before the menopause.
This is the opposite of menopause.
I know. Yeah. So it's because the
Oh,
immune
no.
system is really, really complicated.
Yeah.
So we know that certain bits are being switched on, certain bits are being switched off. And we think that probably estrogen may have a role in that, but there's a whole host of other things that happen during pregnancy that are probably influencing this.
Yeah.
And the reason that you are being so vague is because you can't test pregnant women.
I mean, so to a degree, you when you say test,
Trials. They can't really
Yeah,
participate
cool.
in trials,
so,
right?
so if you're thinking of a clinical trial where you're using a new medicine that's not been used before,
Mm-hmm.
many people are excluded from it if they're pregnant or if they're planning to become pregnant,
Okay.
because we don't know what the new drug that's being tested will do in the setting of pregnancy.
Sure.
So we don't want there to be major risks of that, which means that unfortunately we only learn that medicines are safe or unsafe if people accidentally get pregnant on those drugs over a long period of time, and we see what happens. And that's how we kind of work out that some drugs are safe and some are not safe. But testing during pregnancy, so we can do studies, and there are studies looking at the immune system of women when they become pregnant with lots of autoimmune conditions to try and work out what it is that makes people better, or what it is that might make people worry that things get worse, and just make sure that people can be better monitored than we currently understand. So studies can be done, but you'll be hard pushed to find a drug trial that will be done in pregnancy for something like
Yeah.
lupus.
See, and that is annoying. And same with breastfeeding.
Mm.
So I am told by the internet that I should maybe expect a flare after the baby's born because my body will presumably return to an inflamed autoimmune active state.
Yeah, sometimes the internet is a dangerous place, but I think what I would
Tell
do
me
is
about it.
take that with a touch of caution.
Yeah.
And obviously what we don't want to happen is kind of say things will definitely flare up after you give birth. So we're going to make sure we see you in clinic and we do loads of tests and stuff like that just after you've given birth, because if you've not had a flare up, it's a waste of time and you want to spend time with your baby. But we do know that there is a potential risk, almost like as the brakes have been put on with pregnancy, that those brakes come off a little bit.
Mm.
And most people, again, emphasizing, most people do fine, and there are no issues kind of in the period after giving birth. But we do just like to keep an eye out. So what I tend to say to my patients is, here's the department's telephone number and email. Give birth. If trouble arises, just ping us a message and we'll see you as quick as possible.
Anecdotally, how often would you say that you see trouble after delivery in your practice?
So we sometimes see kind of mild trouble in, maybe, if I was to pull a number off the top of my head, about 10% maybe. So the risk is lower.
Yeah.
But again, certain symptoms do get worse in the later stage of pregnancy that might look like lupus. So for example, lots of people report joint pain with their lupus.
Oh.
But as you get a baby that gets bigger and bigger, you've got more baby to carry, more people experience joint pains. And so it can be sometimes difficult to pull apart whether that's just normal part of pains related to being pregnant or whether it's due to the lupus.
Sure.
So we tend to just be fairly flexible, but we do report it, we do see it, but thankfully it's not in the majority of cases.
So if I ring you up after the baby's born, I'm like, oh my gosh, I'm having like so much muscular pain, like, and also my skin feels like it's pulling, and I'm having all these rashes. You'd be like, that's the facelift.
Well, I mean, it's hard to tell over the telephone. And if I was your doctor, I'd say, let's just get you up to clinic and have a look and make sure it's not the lupus. And if it is something else, I'm
It'll
not
be
going
the
to
facelift.
speculate what that is. Then
It'll be
we
the
can...
BBL. It'll be a collect call from Istanbul. I don't have flares anyway, so it's weird. My biggest problem with autoimmune disease in pregnancy is the first trimester. So I've had 7 pregnancies. 4 of those have gone into the second and third trimester, and then 3 have ended. We don't really know. Again, there's a lot of guesswork with autoimmune response, I guess, but I don't have the like coagulant thing. I do have anti-Ro and anti-La antibodies, so my pregnancies in the second trimester do need to be screened for the heart block. One of my children was born with neonatal lupus, just had the discoid rash. But I do have NK cells, like toxoplasma.
Okay.
cells or
Yep.
something in my first trimester. As
Yep.
soon as I get pregnant, which is great for any young woman, I think, alarm bells go off and my
Mm.
body goes, whoa, 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 whoa. Whose baby is this? Do you think you're making a good decision? And then my first trimester, I think, is really inflamed.
Mm.
So what is the difference in autoimmune disease between that first trimester risk of
Mm.
overinflammation and then second and third eventually modulating?
Cool. So there's a few different things to kind of take from that.
Okay.
And you know, I appreciate you being so honest with this, because I think a lot of people who we see in clinic don't talk openly about these things, and that can be quite isolating for them. So it's good to kind of have this out here and have this discussion. We know that whether you have lupus or you don't have lupus, the greatest risk is in that first trimester. And we know there are certain things about lupus that increase that risk. And that is kind of the time period that we are looking to be very, very focused on. We know that, as you mentioned, kind of the anticoagulant test, there's a condition called antiphospholipid syndrome, which increases the risk of blood clots.
That's what I don't have yet.
That's it. So in the setting of lupus where someone has had miscarriages, it's useful to do that test. And if that test is positive, we then treat those people with blood thinning medicines, because we think that helps the way that the baby embeds the placenta and that the blood goes to the baby. So it's important that those are screened for. I think the other thing to say is you mentioned the Rho antibodies,
Yeah.
and again, you're kind of making this very easy for me to talk about today, because these are the things that we talk about in clinic. We know that mums with Rho antibodies have an increased risk of that antibody, which is very, very small, passing to the baby. And I think you mentioned you get scans fairly frequently in the second and third trimester. That's because we know that if that gets to the baby, it can increase the risk of damage to the baby's heart. Now, again, emphasizing, like I've done all the way through, the risk of that is generally quite low. So only in about 1% of mums with that antibody will that happen. And the reduces risk with that hydroxychloroquine medicine that I mentioned earlier. But it's important that mums who have that antibody, they get monitored really, really closely. And you mentioned the kind of neonatal lupus as well, which is very, very frightening and a little bit more common in people who have that antibody, when the baby usually is born with a rash and looks very inflamed. And we try to counsel people on this to say, if the baby's born with a rash, it's okay, it will go, it will settle down. It doesn't mean that they've caught lupus or anything like that. So those are kind of the discussions that we have as we start to prepare people for pregnancy and as they make their way through pregnancy with lupus.
Great. I mean, it's good to talk about. I think there are a lot of people who don't know and then either can't get a referral or can't get an appointment straight away, and they can just listen to you. And what's my age again? So thanks for all that advice. Yeah, my daughter didn't present with neonatal lupus until she was 3 or 4 months old. So I don't know how long it takes the antibodies. Would that be from the pregnancy or would that be from being breastfed?
Yeah, so it could be a bit of both. So they're probably
Really? You
antibodies
can
that
pass
have
it
come
breastfeeding?
from you. Yeah, so certain immunity in the baby is actually coming from mum. And then over time, as the baby starts to develop their own immune system, then mum's antibodies disappear and they start building their own antibodies. But that's probably the thing. And I think that usually happens within kind of 3 to 6 months.
Yeah, wild.
Yeah.
And then it was gone by 8 months.
Yeah. And again, like back to like what happens and the changes that happen during pregnancy. When you're pregnant, the immune system's almost getting turned down a little bit to protect the baby. And then after you give birth and you're breastfeeding, then we see like this rebound, and not just in people that have autoimmune, but in every woman, where the immune system then almost gets turned on again. And that is because if you're breastfeeding, some of that immunity is transferred to the baby, because at that point the baby doesn't have it has an immune system, but it's not, the tip top fully functioning like an adult has. So it's like the mother's body is responding to what the baby needs at that time. It's protection when it's inside, but when it's out, it does need some of that immunity to pass through from the breastfeeding. And again, looking at biological age, and this is not in autoimmune, this is in all mothers, we tend to see a reduction in biological age of a couple of years when women are pregnant, and then that actually increases afterwards after the birth.
It does a rebound.
It does a rebound.
Oh, no.
Looks like a third test is coming.
Yeah, when you stop sleeping and everything else.
Yeah, because that's it. It's not just the inflammation, it's everything else that's going. It's the trauma of giving birth, blood loss, it's the stress of having a newborn baby, it's the sleep. So there are many different things. The immune side of it is just one little bit. But yeah, we normally see that couple of years difference either side of the pregnancy.
Well, mine will be 20. Mine will be a couple times 10. 20 years this way, 20 years that way. But I have learned a lot in season 1 of this podcast. I do take more omega-3
Mhm.
and I
Yep.
take your supplement and I am just generally less stressed. I
Mm.
am pregnant, but I plan on breastfeeding. I usually breastfeed for at least a year.
Mhm.
And I have worried, especially after my first daughter had neonatal lupus, discoid rash on her
Mm.
head about that time. So presumably you're passing antibodies to your baby through breastfeeding, but
Mm.
my antibodies are auto
Mm.
antibodies. So Chris, what advice do you give to breastfeeding mothers?
Yeah, so I think it's an individualized decision. We tend to follow what the patient suggests, to be honest. So we wouldn't usually say stop breastfeeding unless we were really worried that person's lupus was flaring up and we had to put them on a medicine that wouldn't be safe for them to continue breastfeeding. And then we tend to say we'll follow the advice of what the patient would like to do in discussions with their midwife and their obstetric team. So we don't tend to make any restrictions on it unless we're really worried and put them on a treatment that might mean that it will be passed to the baby in breast milk.
Because if you ingest those antibodies, do you know what I'm saying? Like you're passing good
Mhm.
antibodies, presumably, but are you also passing auto antibodies?
So what we think is probably some of those antibodies, particularly the small ones, are passed actually while you're pregnant. So it's
Okay.
making its way through the blood, through the placenta into the baby that way. We think that probably the amount that's in the breast milk is probably less. So again, we don't tend to make any significant recommendations on that. And if someone said, I'd like to breastfeed for a year, fine, we wouldn't say anything against that.
Okay. And then babies born to mothers with lupus
Mm.
don't necessarily inherit lupus. You
Yes.
don't really
Yeah.
know
Yeah.
where lupus comes from?
Yeah. So it's not hereditary. So it's not like if you have lupus, you pass it directly on. But there is what we call a genetic component to it. So we think that there are certain things that increase your risk of getting any autoimmune condition.
Mhm.
Sadly, one of those things is being female, whether
Yep.
or not you've got a relative who's got an autoimmune condition. But if you do have a relative with an autoimmune condition, that means your risk gets slightly higher.
How much higher?
Difficult to tell. It's
Okay.
very difficult to tell because the other thing that really kind of plays into it is what happens in the environment. And so you could be
Yeah.
exposed to things like sunlight or viruses and things like that. And it's only when you kind of add all of those things together do you kind of tip over this threshold and get the autoimmune condition.
Because you can have genes that are not switched on.
Yeah.
Correct.
Mm.
Yeah.
So I have celiac, for example, and my husband does not. So do all of my children have about a 50-50 shot of inheriting the gene, but then environmentally that gene may be switched on or off?
Yeah, and different autoimmune conditions have kind of different degrees of genetic risk.
Huh.
So if the immune system's complicated, genetics is even more complicated.
Can you guys please figure it out?
We're trying. We are trying quite hard. But yeah,
It doesn't really
there's-
feel like it,
I
Chris.
know. I in the 10 months since I was last here, I haven't got any major new breakthroughs on my side.
Okay.
But maybe in the next year we might actually have some. But I mean,
Really?
yeah.
Do you think in my lifetime,
yeah.
knowing my biological age,
Okay,
though,
okay,
take that into
go on.
consideration, my lifetime,
Yeah.
do you think that there will be an actual cure for some autoimmune diseases?
Okay, cool. So you kind of got me on my soapbox now. So there is a new type of treatment that's being used for lupus that's predominantly been used in Germany, but now clinical trials are all around the world where patients are getting this really, really strong treatment that kind of resets their immune system. It was predominantly used in people with blood cancers. It's a treatment called CAR T cell therapy. And so they
Mm.
started using that in people with really bad severe lupus. And what they found in the handful of patients treated is that they were all able to stop their medicine. All their blood tests became normal. Their antibodies for lupus disappeared and they've remained well. And the first patient was treated nearly 5 years ago.
Wow.
So that's pretty groundbreaking. Now, we're not saying it's going to work for everyone and
Mm.
clinical trials are needed. But we are doing those clinical trials here in the UK. So there is the potential that in the not too distant future, if it's not, as a rheumatologist, we've never used the cure word, but we may have much, much better treatments in the future if these promising results go forwards. So it is exciting. There are exciting times where we may be able to actually genuinely change people's lives with some of these newer treatments. At least that's what we currently hope.
That's so cool, but you wouldn't qualify for that trial unless you were really ill with lupus
So this is the debate that
or
we're
really well connected.
Yeah, this is the debate that we're currently having, is that you have to have a degree of the lupus being active. So you don't, it's a treatment that comes with risk. So you don't want to kind of give it to everyone. But as we learn more and as more and more people get treated and as we get more time and we see whether it does work for 1 year or 2 years or 5 years or longer than that,
Yeah.
then we'll have a better idea of who we need to treat. So
Tested on them.
yeah, I mean, so we do clinical trials on patients who are sick where you don't have many other options. But as we learn more, we might find that actually, if it does work really well for lots of people, we may select different groups. And this is very futuristic. We have learned a lot in the last kind of 3 or 4 years about this, and we will learn a lot more in the next few years. But we may be in a position where we can treat the disease much, much better than we could before.
And then what are you going to do? Move into the arts.
Yeah, I mean, like get hobbies or something like that, maybe.
That
Like,
would be
yeah,
cool.
something weird like that.
What do you think you'd be doing, Dr. Wincup, if you weren't doing this?
Like if everything was done.
Yeah, if you
yeah,
just fixed it. And
I,
then,
right. So I for my 40th birthday, I got a telescope. So I
Yes.
kind of like stand on my roof and take pictures of like space and stuff. So maybe I'll do that. If I've got nothing else to do, I
Mm.
could just like sit there and have a look at the sky. And yeah, but I'd probably need a job or something, and I probably wouldn't be good at taking pictures of the sky. So I mean,
That's
that
a
probably
job.
wouldn't keep it. Yeah, it'd probably.
Hey, I don't like your self-esteem in
Hey,
this episode.
I'm an okay doctor. I'm not a great sky photographer.
Because you're too busy
I know.
managing incurable autoimmune diseases. I think that this could be a real thing for you. Also, I've heard about people shooting drugs into space and then they crystallize and then they come back really active in a new way.
I will keep an eye out for that.
You
when
haven't
I
heard
look
about
out
this?
tonight. No. I've
Nicola,
been looking at the wrong
no.
thing.
You
I don't know anything about this.
None of you. What do you? All right, so you can take certain drugs. You know who told me this? Carol Vorderman, because her daughter is an astronaut
Yeah, yeah.
and a doctor.
Mm-hmm.
No
Wow.
surprise there, or one of the two. But I think she might have been dating an astronaut. I don't know. But you can take like cancer drugs
Mm.
and put them into space,
Mm.
and they do something different in that environment. They crystallize in a cool way, and then they come back, and then they are effective
Wow.
from being in space. I promise you.
So maybe that's what I'll do. If we
Yeah.
manage to sort lupus out, then maybe I need to look at the drugs going into space.
I know.
Maybe.
Why
Yeah.
wasn't I a careers counselor?
That was not where I thought this was going today. But
We'll
yeah,
put a
I
link
mean,
in the notes of the podcast to find out more about Carol Vorderman's daughter's space travel. Not to flex. I love giving birth. I'm really good at it. Happens really quickly. I bounce back. But is it meant to be harder to give birth with autoimmune disease, or just something happened from the trauma of it?
Not usually. I think in autoimmune conditions, providing you've not got kind of arthritis, which obviously causes a lot of pain and makes things very difficult in terms of giving birth, generally we try to individualize this on kind of what the mum's wishes are. From a lupus perspective, we don't kind of suggest any significant changes. The obstetric doctors will frequently call us and say, what do we do? This person's got lupus. And we tend to say, well, if it's all well controlled and baby's doing okay, then we don't have any significant changes to make. But if there are certain complications around perhaps the baby needing to be born early or slightly closer monitoring or something needed, then that's kind of directed by the obstetric doctors on a kind of patient-to-patient basis.
Would it be maybe if you could avoid C-section, good? Because I know women who've had C-sections and they have to take blood thinners. And then if you have the kind of lupus where you also need blood thinners, that's double blood thinners.
Yeah, so usually if you're needing those blood thinners, usually you just get the same thing. So it shouldn't change too much for having both. You wouldn't double up. So if you're on blood thinners, you will probably just stay on blood thinners. We won't kind of go overboard. The dose you're on should hopefully keep things under control.
It is really good that I'm not a doctor because my math on these things, I'm like, double blood thinners. And then why would you need to be born early? Like if you had the heart block, for example,
Yeah.
and you want to get that baby out early and maybe do surgery. Would they do surgery while you are pregnant or wait till the baby's born?
Yeah, so the heart block is where the baby's heart beats irregularly, and we mentioned earlier there's that risk in patients who carry certain antibodies, in mums with those antibodies, and that's why we monitor really closely during that part of the pregnancy. And if we identify it before the baby's born,
Which
then
you would.
well, I mean, providing you know that person's got lupus and that person's got that antibody and they're attending for those regular scans, you would. But occasionally, surprises happen.
Fine.
And sometimes maybe people are diagnosed with lupus during pregnancy. And I've had cases where actually the first symptom of the person's lupus is they went for one of those scans and they found a problem with the baby's heart. And that gave the kind of clue that something was going on there. So in the best case scenario, you monitor really closely. And if you did find that complication, and just to emphasize, we're talking about 1 to 2% of people with that antibody, which is a subgroup of people
Thank
with
you for
lupus, then what we tend to do is make sure that the baby is born in a nice, safe way, and everyone is prepared for if that baby needs to have a pacemaker or something put in. And obviously, that's much easier to do if you're expecting that to happen. What you don't want to happen is that person to have not had those tests. The baby's born and suddenly everyone is surprised and they need to do it as an emergency. So that's why we do that really careful monitoring in the later stage of the pregnancy, just to make sure
Right.
that any problems get identified before they become a major issue.
Because on the NHS, I think you have a 20-week scan and then you really don't have another scan if you're young and healthy until the baby's born.
Unless you've got lupus with that antibody. So if you do have that antibody, then we recommend that people do get more regular screening for that. So again, it's just something that doctors need to be aware of as well, that you can get more regular scans if you've got that antibody.
Because that heart block presents at like 26 weeks.
Yeah, so it's a later stage in the pregnancy after the baby's heart had started to develop. But obviously when the baby's in the womb, it doesn't matter that the heart's beating irregularly because all the blood is coming from mum. But when the baby's born and the baby's reliant on the baby's own heart is where the issue comes. And so it's really important we know about it before the mum gives birth so we can make sure things are sorted when the baby's born. We don't want a surprise that the baby's born and then there's an issue. So that's the importance of doing those scans.
I am in my last and final geriatric pregnancy, and I did not know that an irregular heartbeat in the womb doesn't matter because the mother's blood is circulating.
So it's only when the baby's born that we see the issue. And that's why we really just like to make sure we know about that in advance. And that will be something that influences how we decide what's the best way for baby to be born.
Well, how come then, sorry, I'll go like slightly off piece. How come it matters then when you're in labor and they go, oh, the baby's heart rate's dropping? Why do they care?
So I'm not an obstetrician, and I actually remember this came up in my final year of medical school exams, and I remember this being very difficult looking at babies' heart rates. So I'm caveating that I'm just a humble rheumatologist, but it can be a sign of how the baby is actually managing with the birth.
Yeah, no, it is. Yeah.
So it can just give you a clue that more generally, perhaps that baby is either doing well or there may be something to be worried about with those measures.
Sure.
So they do monitor that when the baby is about to be born, when the mum's about to deliver. But it really is kind of post-delivery that we worry about that heart block problem.
Being a doctor's hard, guys.
Yeah, I'm not that type of doctor, so I'm going to caveat that. I won't be delivering any babies.
But you have delivered one. How was it?
I've delivered my own baby. That was great.
You had a nice time.
I had a great time.
Yeah. I think it's good to tell people about positive experiences too.
Definitely.
Okay. So it's fine if you have lupus, just
Talk to your doctor,
monitor
plan
and
it out,
stuff.
and just make sure you get
Talk to your
reviewed
doctor. Are you
regularly.
worried about being sued?
Yeah. No, but I mean, in all reality, I think that sometimes people feel that they can't speak to their doctors, and if it doesn't get brought up in the consultation, that it's not important. And so what I try to say to my patients is be open. If you've got questions, ask me. If you're thinking about getting pregnant and I've not thought to ask you that, then please just tell me. Don't just let me kind of steal the agenda and do what I want. So speak to your doctor.
Sure.
If your doctor's not speaking to you, that's generally my advice, because we are all control freaks and we would rather no surprises and everything is planned. So if you want to talk about it, it's good to talk about it up front.
I do forget sometimes, Chris, that we are in Britain and people don't speak up about things.
Yeah.
They need to be encouraged.
I really, really do, because we want people to feel empowered
Yeah.
and understand what's going on and why we're doing things. So it's good to have open conversations, and that's what I try to encourage when I'm seeing patients. But if I don't, and if any of my patients are listening, tell me, okay? Bring it up.
Nicola, anything else you want to add? Any apologies you want to make to me?
Why would I apologize?
Because
your biological age is now 20 years lower.
Yeah, but you said I had to exercise. I did about 3 minutes of exercise, if you want to call it that. My husband did most of the work. And I reduced my biological age by 20 years, which I haven't seen you doing.
I am so sorry.
I'd like to see you reduce yours to 0.
One day we're going to do an exercise class together.
No.
And you're going to love it.
I won't love it. I can't do it. I get myself pregnant so that I can opt out of exercise for the rest of the year. So you said you can look at specific markers. Is there anything else that we need to cover related to my groundbreaking reduction in biological age? Anything else you noticed from like the minutia of the test? And then anything I can do to sort of keep this low after pregnancy, do you think?
Yeah, exercise.
No. Well, I do exercise. Listen, if you want to come to my house for the afternoon, I got 3 toddlers in it. When am I
That
not
counts.
exercising?
That
It
counts
does
as
count.
exercise. That counts. I'm only joking. That
I
counts.
squat just
The
constantly picking
vegetable,
stuff
the
up.
fruit, the
Yeah.
de-stress. Maybe that's what may need to come in a bit more into your life, a bit of rest.
Hmm.
I
You're
know.
very, very busy, and now you're going to be even busier. So taking that time to rest.
Yes.
Would you be more open to that than
Well, yeah.
exercise
Well,
advice?
I know that it's difficult to measure,
Mm.
but I really believe that Black and Hispanic women have more existential dread than maybe
Mm.
men do. I really believe that in my journey with autoimmune disease, it is more pronounced for me when I am stressed. And so I think like my anecdotal advice to
Mm.
anybody navigating autoimmune disease is
Mm.
like, nothing matters very much, very little matters at all.
Mm.
And you just have to be as low stress as possible. And
Mm.
like that is why I don't have symptoms,
Mm.
if you ask me. I know there's no like clinical evidence of that, but I really think it matters.
There's a little bit of evidence
Yeah.
that has shown that actually stress does just bad things for your immune system in general.
Yeah.
And we know that many people report their symptoms are worse when they're stressed. I think it's tricky as a doctor because you kind of instantly want to say, okay, stress makes it worse, so don't stress. And
Yeah.
actually that just doesn't work. So what I find sometimes is it's helpful to be a little bit mindful if you're feeling under stress. I think a lot of people don't notice when they're feeling that stress.
Yeah.
And sometimes it's kind of just making those slight adjustments. But we know that stress is difficult for a lot of people and we don't have a fix for that. But being aware of it, I think is certainly very helpful for people just to think about their symptoms and how much stress they're under
Yeah.
and whether there's something they might be able to do to help with that.
Cannabis.
Not currently on the guidelines,
Okay.
but each to their own.
All right. Well, that's all my questions. Thank you. Is there anything, Dr. Wincup, that you want to add about, autoimmunity before you return to clinic? Because you never
Yeah.
take breaks
Yeah,
just
I
to look
know.
at the sky.
I know. Which means I don't sleep as well because then I'm up at night looking at the sky.
Yeah.
So
Well, luckily your nights just got longer. So.
exactly. But the one thing I would say, particularly on the subject of pregnancy, is if you're someone with an autoimmune condition, speak to your doctor about it. Don't kind of think that people don't want to talk about it. And if you're not getting the answers you want, ask those questions. I think as a doctor, it's easy for me to say, I want to make sure I talk about that with my patients. But I think it's important if that's your priority that you make sure that your doctor knows that's your priority so things can be well planned out for you. And hopefully that gives you the best outcome that you want.
And can I give you one more question, actually?
Mm.
For people who are struggling to get a referral to a rheumatologist, who I think anecdotally, again, come to me, they sound to me
Yeah.
like they have autoimmune disease. They are a little bit brushed off or told that they just need to manage symptoms. Is there like a secret key to getting a referral to see a rrheumatologist?
Yeah, I mean, sadly, what you're describing is what we see. So by the time people get to us, often they've kind of knocked on a number of different doors, been given a number of different diagnoses, and then eventually they come to us and we go, aha, we know what this is. And that's difficult because we know that autoimmune conditions as a whole are really common, but individual diseases are quite rare. But the recommendation I usually say is if you're worried you've got an autoimmune condition and you're seeing your doctor about it, just ask. Just say, do you think this could be an autoimmune condition? And as doctors, we don't know everything about every disease in every patient. And sometimes if someone goes, do you think I've got this? It can be the thing that prompts us to think about it. So it's easy on my side where I see autoimmune conditions all the time. But what I definitely recommend is if you're worried about an autoimmune condition, you can always ask and your doctor may reassure you and say we've tested for it, or it may prompt some further tests that gets you to someone who would be able to give you a diagnosis and treat you from there.
And once people see you, they do have an autoimmune condition. You never turn anyone away like, oh, actually, you don't. You're misreferred.
So we test for the autoimmune condition. And if someone has the autoimmune condition that we look after, then we tend to look after them for years, sometimes, in the case of lupus, forever. And if it's not an autoimmune condition, we try and find that it's not. And if we do all the tests and it's not an autoimmune condition, we can hopefully reassure that person that we've looked at it and then suggest who else might be able to help with some of their symptoms.
But a GP can do first line testing and
Yeah.
reveal what?
Yeah, I don't want to get in trouble by telling the GPs what to do. But there are some antibody tests that can be requested, or there's even just some markers of inflammation that can be tested by GPs, and that's sometimes the clue you need. We wouldn't expect GPs to go around diagnosing lupus in every person that's got lupus, because it's difficult. It's even difficult for us who do it day in, day out. But there are tests that you can do that might give you a little clue that this person may have something autoimmune or something inflammatory going on. And then if those patients get referred to me, I tend to say, great, happy to have a look and either confirm it or rule it out.
So if someone happens to ring their GP between 8:01 and 8:02 and they get through to the receptionist and they are gifted an appointment, is there a specific inflammatory test that they can ask for, like ESR or something?
Yeah, so ESR is one of those tests, and CRP is another one. These are tests that are general inflammation. So if you get a chest infection that goes up, yeah. I mean, so sadly, this is the case. A lot of people do have to advocate for themselves, which is a shame when you see people having to kind of fight that hard. But I think that I understand where we're at in the health service at the moment, and things are difficult for patients to get appointments, and also for doctors to be able to see everyone and get every diagnosis.
Just gonna die.
Yeah. So I mean,
I think use your name.
I mean, I do take referrals. Occasionally people
just
message
say
me.
Chris
So
Wynkoop, star rheumatologist.
Yeah, I mean, I'll be sleeping even less. But yeah, no, I mean, what I tend to say is if patients get referred to me, I'm always very happy to see them wherever they may be. But I do need a referral from the GP.
Well, this is what I'm saying. This is the boundary I'm trying to break down. I know you're busy, but presumably there are 3 or 4 other rheumatologists in the...
There's loads. There's in comparison. So, there are probably 50, 100 rheumatologists
Mine's
in
dead.
London. Oh,
yeah.
Sorry to hear that.
Thank you. He was really good, but very old. Diagnosed me. That was the end. He said it can only go downhill from here.
I can recommend many other good ones if you're looking for another
I'm
rheumatologist.
fine, I have you. I've got Nicola, I've got the podcast, and I've got a biological age of 57. So,
Exactly.
If you are looking for free,
What have I signed up
unlicensed
for?
healthcare, no, just listen to everything I say and have like a nice life. And your biological age result might be high, but you won't have flares. And you just, I don't know, have some olive oil. Put Nicola's bonus episodes on once in a while, you'll be fine.
And if you've got lupus, see a rheumatologist, please.
Or don't.
But please do.
Okay. All right. Thank you. Thank you, Chris and Nicola.
Thank you.
Yeah, you're welcome.
Congratulations to me. Thank you so much for listening to this episode of What's My Age Again? I'm only 57 now. I am so thrilled my biological age is headed in the right direction. If you want to find out how old your body is, then you can get the test at a 25% discount with the code What'sMyAgeAgain25. All the details are in our show notes and on our socials, so please subscribe and download and listen to the podcast wherever you get that kind of content. And check out our socials too. We'll see you next time.